Hello, my name is Jules Alejandre, a hydronation doctoral researcher from Glasgow Caledonian University. I am working on blue-green prescribing research. Increased pharmaceutical use contribute to increased pharmaceutical waste and pollution as pharmaceutical substances are released in water environments. Pharmaceutical substances have negative impacts on the quality of water environments as well as the survival, reproductive ability, and behavior of aquatic organisms. Pharmaceutical substances also contribute to the increasing global threat of antimicrobial resistance. Increasing concentration of pharmaceutical substances in the water environments is a major environmental and health problem globally. In Scotland, for instance, residues of ibuprofen, clarithromycin, erythromycin, diclofenac, ethinyl estradiol, metformin, and propranolol were found in various water matrices and are believed to pose relatively high ecotoxicological risks. Additionally, residues of clarithromycin, erythromycin, and ciprofloxacin were also found and are believed to pose relatively high risk in terms of antimicrobial resistance. The state of pharmaceutical pollution in Scotland strives for an upstream solution that could reduce or even prevent further pharmaceutical pollution in its water bodies. Eco-directed sustainable prescribing of pharmaceuticals, or EDSP, could help resolve this problem. EDSP suggests for the reduction of pharmaceutical consumption as appropriate through improved rational prescribing strategies. It promotes the prescription of medicine which have less environmental impacts based on its biodegradability, bioaccumulation, toxicity, and excretion profile. However, the adoption of a changed prescribing strategy in Scotland would require for an in-depth and contextual investigation of existing health and environmental policies related to pharmaceutical prescribing and environmental monitoring. Hence, this policy review analyzed health and environmental policies on medicine prescribing and environmental monitoring of pharmaceuticals. Through a two-phase stakeholder consultation and analysis of 13 health and 11 environmental policies, this policy analysis identified 4 policy gaps and implementation barriers that could hinder the adoption of EDSP in Scotland. We then recommend a 3-pronged policy approach to resolve these policy gaps and implementation barriers. We identified that there are limited strategies in integrating environmental profiles of pharmaceuticals in prescribing guidelines and practices of healthcare providers. There is no detailed operational guidelines and strategies on how to achieve sustainability in prescribing medicines and developing competencies of prescribers to improve prescribing practices. Environmental risk assessment reports are also not transparent and are not considered in the current market authorization of pharmaceuticals. There's also lack of inclusive and multi-agency body that coordinates high-level advocacy for EDSP in Scotland that has diverse set of needed expertise and specialisms. Specifically, there is no ecotoxicity specialist representation in key decision-making groups for pharmaceutical licensing across health technology appraisal bodies. There's also a perceived low level of awareness and knowledge on the environmental impacts of pharmaceuticals amongst healthcare providers and the public. Consistent and sustained education and awareness campaigns are limited specifically in the environmental impacts of pharmaceuticals. Finally, environmental monitoring approaches for pharmaceuticals are limited. Currently, there is a focus on risk-based and compliance monitoring approaches. Medicines identified in the watch list are the ones only monitored, missing other pharmaceuticals that are potentially posing environmental risks. This results to limited understanding on the environmental profiles of other pharmaceuticals being used in Scotland. Considering these barriers, we propose the following policy actions. First, there is a need to organize a nationwide multi-stakeholder expert group on EDSP that would include first and foremost an ecotoxicity specialist as well as representatives from different NHS health boards in Scotland as well as patient groups. There's also a need to integrate environmental criteria in medicine appraisal and formulary development that will guide the development of environmentally informed clinical guidelines for medicine use. Environmental profiles of medicine should be considered in medicine selection and health technology assessment. This integration should be supported by robust and comprehensive environmental monitoring of pharmaceuticals beyond what are included in the watch list. And finally, there is a need to improve stakeholders' knowledge and skills on sustainable healthcare by integrating simple key messages and the environmental impact of pharmaceuticals and ways to prevent this through EDSP in existing health information, education, and campaign materials for healthcare providers as well as patients.